Imagine being born with a ticking time bomb in your body, a condition that could strike as early as 4 months old, leaving you in chronic pain for life. For up to half of all German Shepherds, this nightmare is reality. Today, we're diving into the cruel genetic lottery that affects one of America's most beloved dog breeds. These majestic, intelligent dogs have a dark secret their owners often discover too late. And if you're thinking about bringing one home, you need to know what you're signing up for. The Genetic Betrayal. German Shepherds have a shocking 49% chance of developing hip dysplasia, making them one of the most affected breeds in the canine world. This isn't just bad luck. It's literally written in their DNA. What makes this especially heartbreaking is that the very traits we've bred them for might be causing their suffering. That iconic sloped back and angled hind legs. They may look impressive in the show ring, but they're putting incredible stress on already compromised joints. You might be thinking, but my breeder said their lines are healthy. Here's the uncomfortable truth. This condition is polygenic, meaning multiple genes contribute to it. Even two seemingly healthy parents can produce puppies destined for a lifetime of pain. Have you ever seen a German Shepherd do that distinctive bunny hop when running? That's not cute. It's often the first visible sign of hip dysplasia. The financial nightmare? Let's talk numbers for a moment. If your German Shepherd develops severe hip dysplasia, you're looking at treatment costs that could make your credit card melt. Total hip replacement surgery? That'll be $3,500 to $7,000 per hip. And remember, many German Shepherds need both hips replaced. Think you'll just manage it with medication? One owner reported spending $115 per month just on pain medications. That's over $1,300 annually, potentially for your dog's entire life. And that doesn't include regular vet visits, physical therapy, or mobility aids. You might argue that pet insurance would cover this. Sure, if you got it before any symptoms appeared and if your policy doesn't exclude breed-specific conditions, which many do for German Shepherds precisely because of hip dysplasia. Remember when we talked about that 4-month onset? That means your adorable puppy could start showing symptoms before you've even finished basic obedience training. The quality of life crisis. Now imagine being a dog bred for activity and work. Police work, herding, protection. But your body betrays you every time you move. This isn't just about physical pain. It's about psychological torture. German Shepherds with hip dysplasia often experience chronic pain that worsens with age, difficulty rising, jumping, or climbing stairs, decreased activity and exercise intolerance, muscle wasting as they use their limbs less, depression from inability to do what they love. One particularly devastating aspect? The intermittent nature of early symptoms often leads to misdiagnosis. Your vet might dismiss early signs as growing pains or minor injuries, losing precious intervention time while arthritis sets in permanently. You might be wondering if there's any way to prevent this. Unfortunately, while proper nutrition and careful exercise help, they can't overcome severe genetic predisposition. The heartbreaking decisions. Here's where it gets truly gut-wrenching. Many owners eventually face impossible choices. Expensive surgeries with difficult recoveries, lifelong medication with side effects, or in severe cases, euthanasia, when pain becomes unmanageable. One Reddit user shared that they euthanized their 8-year-old German Shepherd when pain medications stopped working and they couldn't afford surgery. This isn't an isolated incident. If you're thinking, I'd never give up on my dog, consider the reality of watching your best friend struggle to stand every morning, their eyes pleading for relief you can't provide. This doesn't mean you shouldn't adopt a German Shepherd, but it does mean understanding what commitment really means with this breed. It means setting aside money for potential medical emergencies. It means researching responsible breeders who rigorously screen for hip dysplasia through multiple generations. And sometimes it means loving them enough to make difficult choices. So what can you do if you already have a German Shepherd? Start with weight management. Extra pounds put additional stress on compromised joints. Look into joint supplements early, even before symptoms appear. And most importantly, learn the early warning signs so you can intervene before arthritis becomes severe. The struggles of German Shepherds with hip dysplasia highlight something important. Our breeding practices have consequences. The dogs we love shouldn't have to suffer for our aesthetic preferences. If you've experienced this journey with your German Shepherd, share your story in the comments. And if you found this video helpful, subscribe for more honest conversations about pet ownership. Because loving our dogs means understanding both their strengths and vulnerabilities.